Hello, awesome people. My name is Mary, and I am one of your friendly teen services librarians here in the East Baton Rouge Parish Library System. And I would like to welcome you to another iteration of our Interview a Professional series. If you haven't seen any of these before, either live or on YouTube, this is a series where I interview professionals from the local area and ask them a little bit about what they do. So in case you've ever wanted to pursue a job like this, you have a little bit of a better idea of what to expect. So without further ado, I would like to introduce our next person that we are going to be interviewing, Mr. Brian Coward from Acadian Ambulances. Why don't you go ahead and give us a little introduction about yourself and tell us what you do.
First of all, I'd like to say thank you for the invitation. Look very forward to this visit. So like Mary said, my name is Brian Coward. I have been here with Acadian Ambulance for 26 years. I am a certified paramedic. I started out 26 years ago with the company. So I was an EMT, which is the lower level of the EMS field, for about 4 years. And I'm on my 22nd year as a paramedic. I've been fortunate enough to work in the field as both an EMT and paramedic. And I've worked out in the field for approximately 13 to 14 years before I moved into the office in an office setting. And I've been fortunate enough to work out on a ground ambulance. I was a supervisor for a little bit, and then also on our air helicopter.
Oh, wow. All right. Can you give us a quick rundown of what the difference between an EMT and a paramedic is?
Yes, absolutely. So with an EMT, that is the starting point to get into the EMS field. You will go to a class, and depending where the program is taught, it'll usually run anywhere from 4 to 6 months. And you're learning basic life support therapy, things like airway, how to handle maybe choking issues, some trauma, bandaging. So you're treating the basic emergency situations that come up. So you're learning some of the different skills, how to manage that and how to do what you can to help better the patient to have a better outcome. Now on the paramedic side, you must be an EMT before you can become a paramedic. So you take those EMT skills that you've learned and we build upon it. The paramedic class is closer to a year long, and they teach you more advanced skills. So now you're learning more things like drug therapies, the dosages that you have to give, the indications when it's required to give that particular medication, also the contraindications on why you would not want to give it. And then you learn some more advanced airway techniques. If someone is not breathing, what you can do to help he or she to be able to breathe. You learn things like putting the patient on the heart monitor so you can see a full view of the whole heart and see what's going on with that particular situation and able to treat it accordingly by what you see. So it's more advanced treatments and different skills that you'll learn to be able to help treat the patient.
Okay. So like if you ever call an ambulance, is it usually, do you get an EMT or do you get a paramedic, or does it kind of depend on the situation?
So it kind of depends on the situation. If someone calls in and says that they're gonna just need to take a patient to the hospital to get some blood work done. You know, doesn't sound like anything critical. They're not feeling well. We would classify that as like a non-emergency ambulance. So 2 EMTs could go. There's no critical life-saving techniques that we're going to need. The patient needs to go to the hospital. We're going to do vital signs, get them information, and get them to the hospital where they can get some more basic treatment, find out what's going on with them. Now, if someone calls in to 911 and says there's been a terrible accident and it was involving multiple vehicles, and think there's someone that's trapped in a vehicle that can't get out. The chance of they're having some sort of injury or multiple injuries is greater. So
Right.
then we would send what we call an ALS or advanced unit, because the likelihood of that particular call and the mechanism of injury increases substantially. So we want to have the higher trained medic there so he or she can help treat that patient accordingly based on their injuries.
Okay, yeah, that makes sense. That makes sense.
Okay.
All right. So, what made you want to be a paramedic? What made you want to go into this field?
So my mother was a nurse years ago. So she always talked about a little bit of the medical side she had, and the medical always intrigued me. I worked in a couple different jobs prior to this that had some sort of a medical background. One was like a lab and different things. I didn't work in a medical position with that, but it was still a medical kind of, field itself. So that always intrigued me a little bit. And then I just felt like I wanted to, be able to do more for some people, and medical was something that really interested me. And so the Baton Rouge Votech years ago off of Acadian Thruway was offering a class, and I took it, and I said, well, I'm not sure if I'll really like it, but I like the medical, let me see. And I knew pretty shortly once I got into the class that the things that I was learning and they were talking about really interest me. And also I wasn't required to be stuck necessarily in one place or an office. It was out in the field, out doing different things. Each day was something different. So that really made the job more interesting to me.
Right. So, about how old do you think you were when you finally decided, I like this, this is what I want to do?
I was probably around at 23 years of age.
Okay.
I had did some couple different jobs, and when this opportunity presented to go through the class, and I went through it and I got certified, I was somewhere, I think I was around 23. And then once I was able to get hired at Acadian, I just made my 24th birthday. So I started, pretty early on. There's some people that do this pretty early on. They realize it. They'll start at 18 or 19. They know early on this is what they want to do. One great thing that not only the high schools could do, but things like y'all program, it exposes young teenagers to different job opportunities and careers that are out there. When I was growing up, the only people that really kind of came out and spoke to us was really like the military, that came out and wanted to, get people to join the military. But now so many more schools and different programs are offering career fairs and career expos, and learn about what this career does, so people can start thinking about, hey, maybe I don't want to go to college, or I'm not college bound, but I'd like to do something more along these lines, and gets people start thinking at an early age.
Right. Okay. So, what would you say is probably your favorite thing about your job?
So being a paramedic and an EMT was really the people that I got to meet. I was able to meet a lot of different people throughout my time out in the field and feel like I made a difference. Not every day that, I was able to do something where I said, like, I saved a life. And I've been fortunate enough that I feel that some of the things that I was involved in, that I really did make a difference by saving a life. But then also some of the other patients that we had, even the non-emergency patients, just speaking with those people, getting to know them, reassure them that we were there to help, because some of them are scared and they don't understand why they're going to the hospital, or don't have a lot of family that come in and visit with them and really just have conversations. So I think being able to visit with the public and learn some new things because the patients that we were able to transport, they were all different walks of life and different ages. So learned a little bit, some from everyone. And so it was very rewarding for me that I felt like even if it was just talking to someone, and if I could make their day just a little better by just speaking to them, it was rewarding and felt like I was definitely doing it for a reason and had a purpose. Because unfortunately, this is a field that, like some of the other fields, you don't get paid probably what you feel that you deserve or different people see, but you get a payment in a different way versus monetary by just feel like you're giving back and helping someone.
Oh yeah, yeah. I definitely feel that. I feel like there are a lot of professions out there that, the numbers on the paycheck may not be as high as you probably would want, but it's making that difference in someone else's life that really that kind of makes up for it a little bit.
Yes, absolutely.
Yeah. So do you have any least favorite things about your job that you might want to,
Well, so this is a job when you work out in a field, you're working outside in the element, so you're working when it's real hot.
Yeah.
You're working sometimes when it's real cold, when it's raining, which we've had a lot of rain here the last 6 weeks. So you do have to think about that side of it where you're working out in the element. And you're dealing with different people that unfortunately some are going through a real tough time. They're sick, they're hurt. They may have had a, tragic event that just happened to them or their family. So you're seeing sometimes some people at kind of their worst points. So being able to manage that and the emotions and be able to, work through it. Probably, and then unfortunately, you're seeing some different things like blood, vomits, maybe, some urine or feces. And that's a field that you're going to be involved in. Some of those parts of it, I probably would rather not have to deal with on a daily basis, but that just goes along with this field.
Yeah, that's understandable. Yeah. Those are some things that I probably wouldn't want to deal with either on a daily basis,
Right.
to be honest with you.
Yeah.
So kind of thinking back to when you were a student,
Yep.
What would you say your favorite subject was when you were in high school?
When I was in high school, more kind of some of the sciences and anything that I could do more kind of hands-on. And that's one thing with this field. You have two components to it. So you have the lecture part. So you have to listen to the teacher, you have to read the material and study, then you have to take a physical test. But then you have the hands-on skills. So if I'm teaching you about the muscles and the ligaments, and if someone hurts their shoulder, I'm teaching you about all the things that you need to be aware of on what's going on with it, what is involved. But then the second part of it is I'm teaching you the hands-on skills. So now you have that hurt shoulder. How do you treat it? How do you bandage it? How do you support it so you don't cause further injury to the patient? So that's where we pull out the equipment. And how does the equipment work? What are some things you need to do to modify and take care of that particular injury? And so you take all the lecture part that you've learned, but then the hands-on skills. And I'm more of a visual learner. So the hands-on skills were easier for me to understand and be able to work through it. So the sciences and anything I could do more with my hands really, felt like I was accomplishing something.
So you're talking about equipment. So whenever you're doing those hands-on things, you have like models of like that shoulder or
Yeah, so
like dummies and things like that?
Yeah, correct. So for certain injuries and stuff, let's say that shoulder injury I was talking about, what we did is the other students that are in the class, they are the patients. We take turns. So would we do skills days? So let's say if you and I were working together and we had a patient. They fell, they hurt their shoulder. Then it's a simulated injury. We come in, we speak to them, we interview what's going on. I fell off the horse. I hurt my shoulder, I can't move it or whatever. Then you and I will take the equipment that is given to us. And by that time, we learn how to, work it, operate it and stuff. And then we go in and we apply that particular equipment to the patient, securing the arm in place, making sure that, there's no further injuries that could cause them more harm. And then we get them to the hospital so they can be treated accordingly.
Okay.
Yep.
Okay. Do you have any hobbies, whether they tie into your profession or not?
Well, I tell people this is a field where, and believe it or not, I was a shy person when I started this job. I wasn't one to really come out and start speaking with a lot of people and really kind of take that lead. When you go working out in this field, the EMS field, you're going to people's homes and residences and even businesses and meeting people you've never met before. So you're going in and you're asking them all these questions and you're interviewing them. And, so you have to have, I say, be personable. It helps to be able to have a bedside manner and passion for the job that you do, and compassion for the patients that you're going to take care of. So you have to really enjoy your job. You enjoy doing this field. It's meaningful to you. And then the patients that you pick up, no matter what their injury is, whether it's a critical patient or really a non-critical patient, you want to have compassion for that patient, because even though I may not think it's a real critical call or critical situation to me based on my training, it is critical or important to that person. So I want to treat them as such and let them know that we're there to help them in whatever way we can.
Okay, all right. Why don't you go ahead and walk us through what a normal day on the job is like for you?
Okay. So, we have different shifts. Most of our shifts are based on a 12-hour work schedule. It could be during the day or it could be at night. So depending on which shift you work, some of the requirements will be a little different. But let's say for a day shift, you come on, and usually we ask people to get here at least 15 or 20 minutes start earlier than their start time. So that's their time for them to get to the office or the station. And as an EMT, they can start going through their job duties, which number one job duty is to check out the ambulance and the gear that we use. So checking out the ambulance, you want to check out, basic things like, okay, does it have fuel? When do we check the oil daily? Is it, have a ample enough of oil? We look under the hood and check things like, are we missing a, certain cover, or is there a crack in the belt? We don't do a lot of mechanical things, just a quick overview, make sure that it's in working order. Then we go walk around the truck. Is there anything, or the headlights working? Is the horn working? Is the siren working? The mirrors on the truck. We check the tires. If for some reason we see a tire that has a big gash in it, or, it's unsafe that a tire could blow out while we're driving, we alert the shop so we can get that taken care of. So we check the truck itself, is it in good working order? And that's inside and out. Then we go through and start going through our gear. So in the back of the truck, we have a lot of different equipment. Things like the stretcher, we pull the stretcher out. Does the stretcher work? Is it working properly? Our stretchers are battery powered. Are the batteries charged? Is there any issues with the stretcher? Is any pieces missing from the stretcher? Then we go into the back of the ambulance and we look with cabinets that has all our different supplies. And we look at, make sure that we have ample enough supplies. Each truck has also a what we call an inventory sheet. So we kind of go through the inventory and make sure if it says you're supposed to have 8 of this particular supply, do we actually have 8? You know, so we go in and kind of count those things. So we go through all the cabinets, make sure, you know, things like oxygen mask, bandages, tape, gloves, goggles, face masks, safety glasses, oxygen, you know, so all those things that, you know, we make sure that we have to be able to do our job and everything's in a working order. If for some reason we don't have enough supplies we need, each station where we're located has a supply closet. So we can go in there and hopefully get what we need to replace the truck. And if for some reason that we don't have enough supplies or we're missing something critical, we call the on-duty supervisor, and he or she would meet up with us to bring us the items that we would need. And then, so now we've got the truck checked out and the gear, and depending on where you're located, some areas are a little busier than others. Now, while we are doing that, your partner, because you do work with a partner, whether it is an EMT or a paramedic, they're doing the same sort of thing, but the paramedic is checking their more advanced skills, things like the monitor and their medications and their needles and different things that they would utilize to do their job. Once everyone checks all their stuff and we have everything we need to really be what we call in service, we log on, let the dispatcher know, and then they will dispatch us to different calls based on what's going on. And sometimes we sit at a station, and as calls come in, we respond to them, take care of the patient, assess their situation, treat them accordingly, take them to the hospital that either one, they want to go to, or two, that is the most appropriate to handle the situation they have going on. And then we have paperwork we have to do. We have to clean, sanitize, you know, restock the truck after each patient, making sure that we're ready to go and take care of the next patient. But especially during this time with COVID, we do an extra deep cleaning and disinfectant of all the inside of the back of the ambulance, our stretchers, the sheets, and so forth. And that's pretty much it throughout a 12-hour time period. And then, of course, this paperwork we must complete. We have a patient care report for each patient that we pick up, and we do it on iPads. So it's a lot of programs that are already built into the iPad. So there's a lot of drop-down boxes. You go in and kind of fill in the information, and when you submit it, that is the patient care report we utilize for the treatment if the doctor needs to see it, but then also for billing purposes, you know, for getting reimbursed for the service we provide. And then at the end of the day or the end of the night, whenever your shift ends, you go back to the station, and there are certain duties you have to do, making sure the truck is full of fuel. We wash the trucks inside and out. At each station on the outside, it has what we call a wash bay. We have big, large brushes. We wash the trucks. The inside, we sweep out. We kind of wipe down. We disinfect. The back of the ambulance, we disinfect real good, make sure everything is clean, sanitized, and ready for the next crew coming on. And then we complete any paperwork we have. And in each station, we have certain station duties to do. Certain trucks, like if I'm assigned to this particular truck, okay, this truck's duty is assigned to maybe sweeping the floor or taking out the trash or cutting the grass or different station tasks to help keep the station clean and sanitary, because a lot of people come in and out of that station, and some people, if they're on a longer shift, may stay there during their time for work. So that's pretty much it in a nutshell. So
okay. Well, it sounds like so would you say it's a busy job, or is it up and down?
A lot of up and down. So depending on the area and kind of what's going on certain days, the call volume will vary. I've seen that in a 12-hour shift that you may just run 1 or 2 calls and you have some downtime. But then I've seen that people run 10 or 11 calls in a 12-hour period. So with our company at Acadian Ambulances, we are a rural ambulance service where we provide coverage to some more outlying areas. So an area where it's a smaller, more spread out area, there may not be as much call volume that goes on where, like in maybe a bigger city in Baton Rouge, in the city limits and stuff. So some of those trucks may not run as many calls as the other trucks, just due to kind of that area. So it is a up and down field. That's what a lot of people like about it, that the unknown, that yes, today I could go run 1 or 2 calls, or I could run 8 or 10. So the busier you are, it does make the day go by quicker. There's some times you're like, wow, you know, we're already 8 or 9 hours into our shift and it seems like we just started. So it is a field, there are a lot of out working in the public, working around different areas. You'll see a lot of different areas, meet a lot of people. You're working with law enforcement, fire department, different agencies that, you know, will be there when you go to run calls. So you have to, you know, develop a good working relationship with those people and to be able to make your job easier and take care of the patients.
Okay. Yeah, that makes sense. All right. How about, you know, if you weren't a paramedic, if you didn't think to take that class, what do you think your second choice of job would have been?
That's a good question. So I had really considered the Louisiana State Police years ago, working as a state trooper. And when I was going through and getting all the information, I found out that there was a qualification that I didn't have. So I was going to have to go through some additional training to get it. So if I would have probably had that qualification, I would have probably, you know, applied to go through to be a state trooper and hopefully go through the academy and finish that program. Another form of helping people, you know, giving out into the community. I've also, you know, thought about years ago that I wouldn't have minded being a teacher, you know, teaching, you know, certain things. Now, like with this field, what would be an ideal thing for me is, could I go teach an EMT class like in a high school? And there's some schools that offer those things because I still get to stay around the EMS field and talk about it and educate people, but also in a teaching role, which is something that had to interest me. So I don't know, maybe a little later on, maybe as a second career, maybe I consider doing that.
Okay. All right. Yeah. So what qualities would you say are most important for a, you know, a high school student or a young college age student to have to really succeed as an EMT or as a paramedic?
Okay. So you definitely have to hopefully enjoy medicine, or medicine interests you, because the things you're going to learn are going to be important. You have to have, like I talked about earlier, passion for the work that you're going to do and compassion for the patients, no matter what field you're in that you're going to take care of. A good bedside manner, meaning that you can speak to people. Even though that I just met you, some of these situations that we're going to be dealing with, they're going to be high anxiety, high stress, very chaotic. You'll have different people around, bystanders, people that you've never met before. Can you manage those situations and be polite and professional about it? That's for an 18 or 19, 20-year-old young person that really hasn't had maybe a lot of life experiences, that can be a little difficult. People that work retail or fast food or stuff, they're dealing with customers. So they're learning customer service. The patients that we take care of through our company, we call them our customers because they are. Yeah, they are patients, but they're our customers. So we have to have a certain way of treating them and giving them the customer service they deserve. It just happens to be in a medical field, so to speak. So people that have work in the retail or restaurant, server, fast food sort of industry that they're dealing with customers, they should learn how to speak to people and ask questions and kind of come out of their shell. So I think that'll definitely be helpful to them.
Okay. Do you need a college degree to become an EMT or a paramedic?
So at this time, you do not need a college degree. The programs, both EMT or paramedic, are a certificate program. The EMT class, like I said, depending where you take it, anywhere it can be from 4 to 6 months. And during that time, you're learning the lecture part and the hands-on skills part. And at the end of class, you have to show proficiency in both. Make a certain amount of grade in the class, but then also they're going to grade you on your hands-on skills. You finish that to complete the class, then you sit for what we call a national registry certification. You're doing the same thing, but you're taking a computer test for the lecture portion and then hands-on skills. And once you pass both of those, you're able to become certified. You have to be an EMT before you become a paramedic. So same sort of class setting for the paramedic, but it's a longer class. It's a little over a year. When you finish the paramedic program, because we are affiliated for our paramedic program through South Louisiana Community College here in Louisiana, you will gain college credits while you're going through the paramedic program. So even though when you finish the paramedic program, you will complete and get a certificate, you can take 5 online courses when you're done with the paramedic program and complete those, and you can get an associate degree in allied health. So it's not required to have a degree in this field because it's strictly a certificate program, but there are opportunities to do that. There are some programs that are being taught around the United States that the programs for paramedic are either associate degrees, they finish with associate degree no matter what, and then there are either some bachelor programs that are being taught where it's a full 3 to 4 years.
Okay.
But to work out in the field is strictly a certificate program and gaining that certification.
Okay. That's very interesting. All right. Do you have any funny or interesting stories about your time as a paramedic or as an EMT that you'd like to share with us?
Yeah, I mean, it's I've had a number of different stories where, and just events that you never really knew what you were going to go into. That there was, I think one time, one of my partners, we had went to a place and one of the chickens or roosters had chased him kind of out of the yard, was trying to kind of like peck at him and chased him out of the yard back toward the ambulance. He wasn't a real big fan of, farm animals as it was, but for whatever reason, this rooster had really just kind of honed in on him and really started chasing him around, and it kind of freaked him out. So we got a good laugh out of that. I had one where I went to pick up this elderly lady that had fallen, and she has a big German Shepherd dog, and the dog was outside, and her neighbor, who was another elderly lady, and the dog was very protective of her. And the dog was outside, and we were inside kind of taking care of her, and the dog saw us through the window and thought we were harming the lady and was very aggressive, wanting to come in and get us. And the lady had mentioned something about, oh, I'm worried about my dog. And the neighbor said, "Oh, would you like me to let your dog in the door?" So the neighbor kind of started walking toward the door. We're taking care of the patient, and the dog, you could see him, he's like, "Hurry up, open the door, I want to get in." Because I knew if she let that dog in, it was going to be real bad real quick. So luckily we were able to stop her, and the dog didn't get in, and we didn't have any issues. But simple things like that you kind of laugh about, that you'll come across certain calls and be like, "Did that really happen? I can't believe that happened. What was that?" And you'll laugh and be like, that wasn't real. Or how did that car end up standing on its hood like that? Kind of accident. Luckily nobody was seriously injured or whatever. But I tell these people that you never know what you're going to get. Just because the call comes in one way, you have to really you think that, yes, this is what we're heading to, but you get there and like, that is not anything what they said it was going to be like. So those are a couple interesting stories that I like to tell.
Yeah, you go out there saying, all right, a guy fell off his horse and broke his arm, and then you get out there and you don't think, I'm going to end up getting chased by a rooster today.
Right, yeah. So it's pretty neat.
Yeah. All right. I think probably the last question we have for today would be, what advice do you have for teens who might be interested in pursuing being an EMT or going that extra step in becoming a paramedic?
Well, so there's different agencies that offer different programs. I know here at Acadian, we have what we call a high school explorer program. And that's anywhere from, you can enroll from the age of 14 to 20. And it's a volunteer program that if you have interest in medical or maybe even this field, you can sign up and you attend a meeting once a month. And we have meetings locally at our stations, and we teach you certain skills, medical skills, and you can volunteer for different events that we have. Whether we work like a rodeo or a football game or a festival, you don't get paid, but it is volunteer. So you're able to see that side of this career field. And also you can do some ride with a crew on the ambulance, kind of shadowing them. So it'll give them some real good insight on, hey, I think I'd like to do this, or I like medical, but I know I don't like that part of it. I much prefer being in a controlled environment, in a hospital or a more controlled setting versus being out in the element. So I think that would be one of the big things to look at your local places. But through Acadian, it's called the Acadian Ambulance High School Explorer Program. Maybe if you're interested, you could also get with your local fire departments. Some fire departments will hire people as volunteers, and you can volunteer with the fire department, run some calls, and get a feel for the pre-hospital setting.
All right. Well, that's very interesting. I'll definitely have to recommend that if any teens come looking for that kind of opportunity, because that sounds like a really great chance for teens to definitely get a taste for what a paramedic or an EMT might do. So
absolutely. And
definitely.
I can email you some information. And when I'm in the area, I have different pamphlets I can drop off, so.
Oh, that'd be awesome.
That way you can pass it around and hand out to people.
Yeah, that would be awesome. Yeah. So I think that's it. This actually went on a little bit longer than I expected, but that's okay. That's okay. That's more information to give our teens a more informed decision on what they might want to look into in the future. So I would like to thank you again for coming out and I guess coming out through Zoom and speaking to me today about what you do and about EMT paramedic field as a whole. And I'd like to thank anybody who is watching this here on YouTube later on. And thanks for coming out, y'all. And always remember to stay awesome.